of Robin Williams. She released a statement saying the late actor was in the early stages of Parkinson's disease when he died. Williams' wife, Susan Schneider, said in part, quote, Robin's sobriety was intact and he was brave as he struggled with his own battles of depression, anxiety, as well as early stages of Parkinson's disease, which he was not ready to share publicly, end quote. Williams was found dead Monday after committing suicide in his Bay Area home. You can read his wife's full statement on abc7.com. And Parkinson's disease is an incurable nervous system disorder that involves movement.
Among the early symptoms of the disease are tremors and depression.
Health specialist Denise DeDore joins us with a closer look at this disease that impacts millions around the world.
It does so many people. Parkinson's disease happens when nerve cells in the brain don't produce enough of an essential chemical. Again, it has no cure. For many, it can be a devastating diagnosis. In time, this disorder robs people of their ability to multitask, react quickly, and think fast.
I do voices. Yeah! Look at me right now, Moneypenny. Want to undo that bow and get to know you.
I'm crazy to make a deal with you!
Rapid-fire improv is a talent Robin Williams is famous for. Now we've learned the comic genius was faced with a neurodegenerative brain disease that would, as it progressed, ultimately slow him down. Neurologist Grigor Harutunian says Parkinson's disease attacks the body's connection to the brain's main control center.
The brain tells your arm to do something, and because of that dopamine transmission is slowed, it takes a while for you to get that. And all these symptoms come because you're starting to lose dopamine.
The goal of medication and therapies like deep brain stimulation is to replace the low levels of dopamine. 10% of cases are genetic and occur in younger adults. 90% of Parkinson's cases have no known cause and develop when people are in their 60s. Symptoms like trembling, slowness of movement, stiffness, and loss of balance and coordination can begin gradually. Medications can help delay the onset, but doctors say in high-functioning people, the symptoms can be much more noticeable sooner.
You're slow in multitasking, you cannot do things as fast, you cannot process information as fast, your thinking slows down.
Studies show major depression is present at any given time in 20 to 40% of Parkinson's patients. Dr. Harutunian says the key to helping newly diagnosed patients is to tell them what to expect, to help them understand how the disease will progress. But in people with a history of depression, a Parkinson's diagnosis can worsen the depression.
And Parkinson's is a big stressor. Parkinson's can be a huge stressor, especially someone who's battling depression. Absolutely.
But Dr. Harutunian says he has many patients diagnosed with Parkinson's who lead full, active lives many years after diagnosis.
It's not curable, but definitely very manageable and treatable.
The presence of a tremor is a classic early sign, but not all tremors indicate a person has Parkinson's. One characteristic sign, though is an involuntary movement that doctors call pill rolling. It looks like a person is rubbing their thumb and their index finger together as if there's a pill in between them. It's found in about 70% of those with Parkinson's. Again, early detection is key in managing this disease, like in many conditions like it.
All right, Denise, thank you. And our coverage of the